How would you know if you need PT or not? These are the things that I think of when I have an injury of my own. I'm not immune to injuries. I get hurt too. I'm only human. So like things that I look out for in myself is if I get hurt right then and there, something happens, I roll my ankle, the lift goes bad and I feel a sudden sharp pain, I always give it 2 to 3 days just to settle. I don't panic. I don't pick up the phone and immediately start calling friends like I need to get in quick. I just try to remain calm, let the dust settle, let my body handle that first stage of healing on its own. Things that I look for is if it's an acute injury that just happened, I usually like to give it about a week, sometimes even 10 days, just to see if it's going to start progressively getting better on its own. However, if 10 days goes by, 2 weeks goes by, it doesn't seem to be getting better on its own, that's when I start picking up the phone. Another thing that I like to pay attention to is if my pain is preventing me from being my best at work, if it's preventing me from performing the best I can at the gym, if it's getting in the way of me being a dad, that's when I start thinking, okay, I need to see someone to help get a solution for my problem. The other scenario in which I think PT is really valuable is if you've had a nagging, it might be mild, but a persistent chronic issue, let's say 3 to 6 months, sometime even years, of having a problem that just doesn't seem to be getting better. Sure, it's not getting in the way of work, it's not getting in the way of life, it's not getting in the way of fitness, but it's just there and it's annoying. I think you can get a ton of value from contacting a provider that you trust and just getting their opinion on it. So I think in those two scenarios, that's what I would do. Once that initial phase of like pain and the body's just trying to calm things down is done and you're ready to start building yourself back up and building resilience, we switch to love. Love stands for, the L is load. Bodies tend to heal better when we're being active, when we're not avoiding the painful area, but we're purposely stressing it. It's like one of the things I tell my clients is the worst thing you can do is nothing. Don't become a couch potato, don't go on bed rest. Like, let's try to move and use that joint to your pain tolerance, and obviously don't piss it off, but don't do nothing either. That's counterproductive. The O of love is optimism. We are fearful, avoidant, if we're anxious about our pain, if we're catastrophizing or making it a bigger deal than it is, we have some evidence saying that those mindsets about our pain will actually create negative habits for us in the future. You don't want to ignore your pain and be we call them like endurance copers, where you just grit your teeth and suck it up. That has its problems, but you don't want to swing the pendulum the other way and be so fearful that you're taking 2 months off of fitness because you want to wait for this to go completely away. No, you want to be optimistic that you're not dying, you don't have a permanent injury. Feel free to use it even if it hurts a little bit. V is vascularization. Usually that's done through cardiovascular exercise. I think people sleep on how important doing cardio is for our body's ability to heal. So recommendations I give people is 30 to 60 minutes of an easy pace, pain-free cardio equipment. So like getting on a bike, if it doesn't hurt, bike 30 to 60 minutes, 4 to 5 times a week is huge for improving blood flow just systemically. Blood's great because it helps bring the groceries in and it takes out the garbage, right? It brings new blood flow to the painful, injured area, but it also helps remove any inflammation, cellular debris, damaged tissue away from that injury as well. So simply just doing steady state cardio can do like wonders for our ability to heal and recover. And then the E is exercise. Finding specific exercises that are addressing your specific deficit. So with the example of an ankle sprain, like if my ankle is a little stiff with my ability to bring it up, I'd use exercises that improve my mobility. Ever since I sprained my ankle, my calf just feels a little bit weaker than the other side, I'll use exercise to strengthen that calf to make it more symmetric in strength. And the good news is that you don't have to be perfectly symmetrical. A good rule of thumb is as long as I can get my calf 80 to 90% the strength of the uninjured side, we're golden and we're good to go. What are the most common things that I treat? I treat a lot of overuse injuries, things that have kind of gradually worsened over a period of time, over the course of weeks or a month. Whether it's a pinch, kind of like a sharp pain in the shoulder that's kind of progressively worsened and is now stopping you from, I see this all the time, like my CrossFitters. It started off as just a little stiffness and it slowly progressed to some actual pain that's taking their numbers off of the bar. I see a lot of low back pain that started off as just a little bit of tightness and now they can't bend forward at all without getting that kind of like stop you in your tracks pain. And I see a lot of athletic injuries. You roll your ankle, boom, big injury right then and there. Yeah, I see a lot of muscles getting strained. I see a lot of joints getting sprained. I'll even surprisingly treat a lot of like headaches and jaw pain patients too. Things that aren't commonly associated with PT, but I treat a little bit of everything. I've seen physical therapy improve athletic performance. First thing that comes to mind is like my runners. A lot of times they'll have a small weakness of like a particular muscle group. For example, like a guy I treated recently, he was running fine and he was running fast, but he just knew it wasn't truly all he had. It wasn't 100%. So we deep dive. I looked at everything. I was looking at his ankle, his knee, his hip, his low back, his mid back. We were checking out the whole chain, and what we found was, hey, this muscle in his front of his thigh, his quad, was 70% the strength of his other side. Now, when we tested it individually, isolated, it was extremely obvious that this muscle was significantly weaker than the other side. But in real life, we don't use muscles individually. We use a bunch of muscles simultaneously. So when his whole leg was working as a team, it wasn't as obvious of a deficit. And that's where I provided a bunch of value. I was able to tease out those individual. He's had a little bit less range of motion in his hip. His knee or his quad was significantly weaker than the other side. We fixed those few deficits, or helped show them ways to correct them and improve them. And all of a sudden, boom, the whole puzzle came together, and he took himself from, he felt like he was at 95% of his best to, okay, now he feels like he's running at his absolute best.